My name is Sunil Bhat. I'm from Nigeria, and I brought my children here last year because they were diagnosed with Sickle Cell Anemia. 2 of our 3 children, and were introduced to this hospital, Narayana, by some of our friends and doctors in Nigeria. When we were seeking solution, we were told we have to do BMT, and we found out that okay, BMT can be done in India. We had other options, but fortunately, Dr. Sunil Bhat came to Nigeria with Rajiv. We met with them, he saw our children, and we were very comfortable. We just felt, no, we love what we've had. So we started the plans, the process of coming here. So finally we arrived, and immediately, in fact, the first day we saw Dr. Bhat upon our arrival, treatment started. I was wondering, wow, was it already planned for? But that's just the way it is. And before we knew it, our first son was out of BMT. Our second son went in. He also came out. Both cases very successful.
Judah and Sonaye, who had come here for the treatment a few months ago. Both of these kids are suffering from a disease called sickle cell disease. And this is a disease which is very rampant in African subcontinent and also other parts of Asia. And what happens, most of the children, they develop complications in form of pain crisis. They can develop strokes and issues because of that in other parts of the body as well. So Sonaye, for example, already had, he's 8-year-old now, and had developed already a couple of incidents of stroke when he was in Nigeria, and because of that he has already got weakness in one half of his body. Judah was younger, he's 3 to 4 years of age, but then he hasn't had major complications of sickle cell disease because he was young, and we had to treat both these children. The only curative treatment for this condition is bone marrow transplantation, and unfortunately there was no fully matched donor available for these 2 children who could donate for them for the bone marrow transplantation. So we had to decide to take one of the parents as a donor. Parents are usually half matches, and their father was a half match with them. So that's one challenge which I had to go through, and that was using a half match donor. And father we selected as a donor as half match, and he donated it for both the children to undergo bone marrow transplantation. Sonaye had transplanted in January. Now he's about 5-6 months post transplantation. Judah had transplanted in March, and he's also now 3 months post transplantation. Both these children have been cured of their disease, which was sickle cell disease, using half match cells from the father.
What's the cost of happiness? What's the cost of joy? What's the cost of having hope? You can never ever pay for such. But coming to Narayana, I've found out that with the success of the BMT treatment, I have hope. With the success of the BMT treatment, I have joy. With the success of the BMT treatment, I have happiness. A lot of times you say, oh, I've paid for this service, but did you pay for the smiles the nurses give to you? Did you pay for the doctors, just ensuring everything comes out successful? There are no shortcuts. And I think this is what Narayana stands for. They have brought together, their personnel have been trained to the detail.
We are very glad that we came here troubled. We arrived here heavy-hearted, but we are going back with smiles on our faces. We are going back with joy. We are going back very happy.